our two speakers. Now we're going to tweak the format a little bit here and hopefully bring you in a little bit more. So we've got two speakers, Margaret Batty from WaterAid, who I'll introduce a little bit further in a moment, and God, I've forgotten who the other speaker is now. Sam. Yeah, there you go. There's two Sams, you see. I've got this in the back of my mind. So Sam Parker from Water and Sanitation for the Urban Poor. Now I'm going to give those two speakers less time than we had for the previous speakers, so they'll get 5-ish minutes each, and then I'm going to bring in our expert discussants, our panellists, to fire a few questions in their direction. Now these are experts, who don't spend their life, as some of us do, thinking, well, that sounds a bit sad actually, but their day job pontificating over water resources management and service delivery. They come from different areas of expertise, and this is the point. So we want our speakers to be quizzed by people who have expertise in other areas, particularly around change processes, let's call them that. So, bit like Prime Minister's question time, if you like, but sort of nicer and without the heckling from the backbenchers. That's you lot. So first, let me introduce Margaret Batty, who is Director of Policy and Campaigns at WaterAid, has been since 2008. Lots of experience. I mean, you've got the bios in, if you haven't spotted them already, in the back of your program notes. But I think a lot of experience in different sectors. Good length of time now at WaterAid, which is obviously an NGO which punches hard. So Margaret, over to you with your pitch and your top priorities.
Thank you, Roger. No pressure then. Prime Minister question time, interrogation, being quizzed before lunch. Great.
I'm the speaker. That's the worst thing.
I think it's, for me this morning, what's really fascinating, it never ceases to amaze, is how many conversations you can have about water, whether it's about ecosystems or trade or climate change, business supply and so on. We talk about water in so many different ways and feel quite disjointed when we join that conversation from whichever angle we come from. My focus is very much water is life. When Kevin talked about the two focuses of the Human Development Report, mine is human life, human development, water is life, whilst recognising that all of those things intersect, interconnect and depend upon each other. But my lens is on sanitation, so I don't spend my life in the world of water. I'm kind of down in the murky depths and the brown and the sewers and the pit latrines. Nothing like a pit latrine to liven the day. But I think we should just kind of sit back and think it's quite encouraging that there has been progress since the HDR report, which was some eight years ago. And some of the milestones, so the right to water, the MDG target on water met five years early, the right to water and sanitation passed by the UN, the Sanitation and Water for All partnership, which has really evolved in a very short space of time. And I would say it's not often that you would say that an international year of something really made a difference, but I do look back to 2008, the International Year of Sanitation, and for me that marks a change when global debate and dialogue about sanitation took on a new level and has since then. It's not often that we acknowledge progress and success, albeit there's still the crisis remaining. And I think if you fast forward to today and you look at the international political environment, you see Jim Kim, President of the World Bank, talking about the eradication of extreme poverty by 2030. And that's the overarching frame for the new SDG framework. Quite a different conversation to that which we had 15 years ago about the MDGs. There's a real sense in the sector that it is possible to achieve universal access to basic services by 2030. No one's saying that's going to be easy, but there is a conversation now saying that is a possibility, that is a real possibility. And I think when you see The Lancet last month having an editorial on addressing inequalities in WASH, and you have The Economist last month with an article, what was it called, Why Sanitation is Sacred, Poo Matters, then you know that you're percolating in places other than this W world, this water world. We're getting out there a little bit. That said, there's always a but. Really chilling to read the latest reports, the JMP report that came out last week, the 2014 update, the GLASS report that came out last month for the high-level meeting, Sanitation and Water for All meeting. Really chilling to read those, both of them focused on inequalities, really putting a spotlight on the huge challenge that remains, and actually pointing to the fact that inequities have increased over the past few years. And this is of real concern because we're all familiar, I think we're all very familiar, we bandy around the statistics, not glibly, 748 million without water, 2.5 billion without sanitation. But when you look at that cut down, the cut through that JMP and GLASS have done to really highlight the stark inequalities that are actually increasing, this is extremely disturbing. And the cut, you know, you can cut it many ways. It's urban, rural, it's richest, poorest, it's the most marginalised, it's women, it's education levels and so on. But really this is of great concern to the sector. And I think the statement from JMP that progress in sanitation has actually increased inequalities and benefited wealthier people, and that sharp geographic, socio-cultural, economic inequalities stubbornly persist, is not good news for us, is it? The inequality gap is actually increasing in rural areas of countries with low coverage and for marginalised and excluded groups. This is from JMP. And what's interesting, I think, is when we look at the headline figures, whether they're global, they're national, even district levels, these mask huge inequalities. And the technique, the equity tree, I don't know if you've come across this equity tree yet in JMP, the example that they give is of open defecation. So looking at the global level of open defecation, 14%, cut through to sub-Saharan Africa, 25%, take a national example, Mozambique, where it's 40%, and then stratify this even further, and you find that 96% of the rural poor in Mozambique are practicing open defecation, whereas 13% of the richest rural quintile in Mozambique are. So you really start to find some very stark inequalities, which are great challenges for our service delivery. When I say our, I mean governments, NGOs, private sector, everybody. Another fact from the JMP report, that 21 countries report an increase in sanitation coverage, but a decrease in equalities. And of course, JMP hasn't got all the answers. It doesn't look at all of the areas of inequality. It's not looking within slums, informal settlements. It's not looking within households and so on. But there's some real concerns for us here. And I think to layer on the complexity, the figures now about the lower middle income countries. So 52% without access to sanitation are now in lower middle income countries, and 40% without water. And I think if you look at India in the news, the election results upcoming, 600 million people open defecating, almost half the population. In Nigeria, hugely disturbing, we find that sanitation coverage is actually decreasing and inequalities are decreasing. So what's going on there? I think the message from one of the messages in the HDR report was that yes, income matters, economic growth matters, but public policy is pivotal. You can't accomplish real economic growth, sustainable economic growth, human development without public policy on WASH. So I think the broad conclusion, I think everyone in the room wouldn't be surprised to hear that those without water and sanitation tend to be the poorest, the most excluded. That's not a great surprise for us. But I think where there's we need to look in the mirror is when we read that WASH interventions that don't have an equity focus might actually be exacerbating inequalities. And so they fail to reach the most marginalised people. What's to be done? We're talking about a 16-year time frame, which in political policy terms is so ambitious, is so short. You know, with behaviour change, infrastructure, the challenge is immense. Now, Roger said I could have 3 priorities come challenges, which is really tough, so I've crammed loads of things into my 3, obviously. First of all, I completely disagree with the premise of this seminar, which always is good for discussion, isn't it? But I say don't take the foot off the pedal on political prioritisation. We're not there yet. It ain't over yet. The political prioritisation is absolutely key. And I'm really glad that Kevin Watkins stressed that this morning. We can be very much a kind of technical sector. We need political activity, political voice. Secondly, I would propose or suggest that the WASH sector should really align behind WHO and UNICEF and the JMP proposals for post-2015. And I guess most of you will have seen these, the 4 proposals for post-2015, So what should we be doing, whether it's government, whether it's NGO, academia? I think we should be looking at those 4 proposals for post-2015, a little bit later on those. And thirdly, very clearly, we need to be looking beyond the big numbers. We need to be looking at progressive reduction of inequalities, focusing on basic services, and we need to bring in the equity and sustainability. And sustainability is one lesson that we've really learned at WaterAid over the last few years, whether it's financial sustainability, it's technical, behaviour change. We're looking for permanent service delivery, permanent services. Just a couple of points, if I could, on each of those 3. Political prioritisation. Water gets a lot of political airtime, but sanitation, equity, rights, they fall off the agenda. And I think we're in a very key time for the post-2015 negotiations at the moment, and political trade-offs will start. And it's not a given on sanitation particularly. I think in terms of a practical way forward, the Sanitation and Water for All partnership offers a really good mechanism for aligning together behind sector strengthening, a strong enabling environment, targeting of investment, and rationalisation of resource. So that really finds a place where we can all work together. And those of you who follow the SWA, the high-level meeting last month, there was 265 commitments, 55 ministers. But what we need to do is to keep the foot on the pedal politically and make sure those commitments really translate into action. And politics isn't about the money. I think as an NGO, certainly WaterAid, we've really focused on sanitation financing, but it's more than the money. It's about the policies, the services, the good governance that's been talked about this morning. Briefly on post-2015, there is some high degree of confidence that there will be some kind of water SDG, but it really could get stuck in an environmental label, and we're looking at the human development angle. Last week's open working group, water and sanitation survived as a focal area, but there's no cross-cutting goals, targets and indicators, on health, on gender. Water and sanitation is not cutting across the SDG agenda, and we really need to see that happen. And on inequalities, these 4 targets, indicators, or the targets by JMP, one target by JMP. Eliminating open defecation. We haven't really spoken much about that this morning, but if you ever correlate poverty exclusion with one behaviour practice, open defecation, I would propose. And the UN Deputy Secretary General is actually launching a campaign on open defecation, against open defecation in 2 weeks' time, which shows where sanitation's got to politically. Secondly, covering households, schools and health facilities, so moving beyond the household, raising standards and progressively eliminating inequalities. That's really key to the JMP proposals. So in conclusion, I think it's a real shame to say that Kevin Watkins seems to be right, and that his premise in 2006 that water, or WASH, is not due to scarcity, he was right, damn it. So continued poverty, inequality, government failures, and we really need to focus on those issues. The WASH world, I believe, needs to integrate very much with other policy arenas, so health, gender, livelihoods and so on. Again, Kevin said that this morning. And what we need to move to is this paradigm shift where WASH is seen as a foundation stone for human development and not an outcome, something that comes later once we've achieved economic progress. I think the WASH sector needs self-belief. We really kind of pick ourselves up quite a lot and get stuck and bogged down and so on. But it is possible, and there's all sorts of examples in the JMP elsewhere, from Cambodia, Rwanda, Ethiopia, where real sustained progress has been made in a very short space of time. And if you can just humour me with a quote from the HDR report, which I found really inspirational to go back and read, actually, something that's 8 years old, which we don't often do. So to quote from that, and from Victor Hugo, weirdly enough, ultimately, human development is about the realisation of potential, what people can do, what they become, capabilities and freedom to exercise real choices in life. Water pervades all aspects of human development, and here's the Victor Hugo bit, in case you don't recognise it. Sewers are the conscience of a city. And I think when we're talking about inequalities and equity, that is a really good, it comes from Les Miserables apparently, and it was in the HDR report, but sewers are the conscience of a city. Didn't get time to talk about menstrual hygiene management, another proxy indicator of inequalities. But I'm what did Tony Allen say about being optimistic? I think it's a good thing to be optimistic. I think we have to be optimistic.
Good
So
but
I'll leave it there.
dangerous.
I'll do that. You're good but dangerous.
Optimistics are right, but dangerous. Thank you,
Thanks.
thank you, Margaret. Okay, so you crammed a lot in there, but a real emphasis that we shouldn't forget the importance of political mobilization and having targets for people to rally around. And as you pointed out, what we have in the proposed framework now is quite different from the MDGs. Much more ambitious. Hygiene is in there, an end to open defecation. It's beyond the household to health centres to education. This focus, as you were saying rightly again, equity and sustainability, which was not there before. So now I'm going to go over to Sam Parker, CEO of WSUP, Water and Sanitation for the Urban Poor. Now Sam's been there, was the first actually CEO of WSUP, and you've done lots of interesting things in your professional career. But Sam, I'm going to hand straight over to you with your 5-minute pitch.
Thank you, Roger. I can't speak sitting down, so apologies, I'm going to stand up. I can see your faces. Thank you for having me. My name's Sam Parker. I'm going to speak to you for 5 minutes. From over there.
Yep.
During that 5 minutes, around 600 people in the world will move into a settlement that looks something like this. Over the last 8 years, I've spent a lot of my time working in towns and cities that look like this. Families such as these will tell me that they don't get any water supply from the city. They will buy their water from a local vendor at anything between 5 and 20 times the price that's available in the city. They'll tell me that they don't have access to a functioning toilet nearby. But they'll also say that they do have mobile phones. The people living in these flats have 24/7 running water, and everyone has a functioning toilet. When I talk to the water companies, they say, well, the poor neighborhoods are difficult for us. A lot of our water gets stolen, and anyway, people don't pay. In reality, people are paying more than anybody else in the city, and they're paying in cash. When I talk to the banks say, the banks that are financing the city water and sanitation infrastructure, they'll say, well, it's our intention that our investments benefit this poor neighborhood. But we rely on the government agencies to have the skills and the motivation to make that happen. In reality, the city agencies have neither the skills nor the motivation to get water to their family. I talk to local businesses and they say there's no money in delivering water and sanitation services to these people. The reality is, with some encouragement, there is indeed a business to be had. So the question for us was, when we were looking at this, we started working this 8 years ago, how can you turn that around? How can you turn around a failing system? So we started to help cities to see this family not as a burden, not as a beneficiary to be looked after by NGOs, but as a legitimate and valued customer. And to start designing tailor-made services that meet their needs, just like the phone companies are. Paying every day, paying every week instead of paying every month. Paying your connection fee over 2 years as opposed to in one shot of $100. Having a prepaid meter. Having a local distributor that serves you properly. Having a sanitation service delivered to your door. Just like the phone companies had actually seen this segment of the population as a legitimate market, why can't the water companies and the sanitation service companies see them in the same way? At the heart of this was our belief that if you offer something, a service that's worth paying for, that's better, that is more accessible, that's cheaper than what they had before, they will pay for it, and they will pay for it willingly. So there's one other picture, if you would. In Madagascar, we started working there in 2008. And since we've only been around since 2006, this was our the first place we started to work. And we spent about a year doing feasibility, and after about a year, and we had found an area to work in, and we'd met all the government agencies, and we were very excited. And we got a phone call from the utility, the government utility called Giralma. They said, sorry, but we've decided to declare a moratorium on new connections. So all our intentions of bringing water services to the peri-urban, the low-income parts of that capital city were blown out of the water because the company said, well, forget it, there's no water. So I remember very, very vividly flying down in a panic and trying to get a meeting with the State Water Company and the President's office to try and resuscitate this program, which is our first ever program. Without this, we might have, if this wasn't going to work, we might as well shut up shop. Interestingly enough, the water company was really quite reluctant to work with us. It was just too difficult for them. It was quite clear this was just too much of a headache. They had already had so many problems of their own. We consulted with our NGO partners, and they said, you know what we should do? We're going to set up a demonstration outside of the offices of the water company. We're going to have a banner. We're going to say, we demand services for the poor. So I said, well, that's absolutely fine, good idea, but we're going to do something slightly different. We want to go onto the inside of the water company and find out what was really going on. What was really going on is they were losing 55% of their water. So we brought in some private sector, international private sector expertise, and we helped them actually set up a non-revenue water reduction program, which managed to improve their efficiency to such an extent that they freed up water for the poor districts. Not only that, but we helped them set up a model which got water to the people in a way that was accessible, close to their homes, and affordable. And it was generating a viable business for the distributors. So you've got something which is good for the water company and something which is good for the consumer and is generating jobs. Fantastic. Not only that, it was generating livelihoods around laundry and around providing canal cleaning services. Then the World Bank got interested. The World Bank said, well, hang on, this is good. This is financially viable and it's working. So then they scaled this up across the other half of the city, and they've already taken it into a second city. We've got the banks interested. Then we started working with local private sector, and we got them to go from solid waste collection, garbage collection into the pit emptying business, and then into the canal cleaning business. So now we have a situation 6 years down the road where more than half of the people living in the poor neighborhoods of that city are now receiving services which they never received before, and that's growing. Probably within 2 or 3 years, there will be none left. So what have we done? We have built skills and motivation from the service provider, we've activated the banks, and we've activated local private sector. So using this sort of methodology over the last 7 years, we've helped cities to reach somewhere almost 2 million people. We're on track to reach 4 million by the end of next year. But that's only just the start. There's 300 million in the world without water and 890 without sanitation in urban areas. So to answer the question that Roger put to me, how do you address the stubborn inequalities that still persist? I would suggest 3 things on the basis of the experience that we've had over the last few years. Number 1, help cities and towns discover all of their customers and design services that are going to reach them and serve them, converting a monopoly mindset into a marketing mindset. That's number 1. Number 2, mobilize local private sector and then leverage international private sector and make it available to cities in a much more accessible way. A lot of this work we've done drawing from expertise from international private sector and combining it with NGO expertise and civil society expertise. Package it and offer it to cities. And finally, number 3, help the development banks rediscover their purpose. So help the World Bank find out how to make sure that the huge investments it's making in water and sanitation infrastructure will actually reach everybody in the city and not just those who already are well served. And I think if we apply those 3 principles, it will go a long way to ensure that the people living in those settlements would have as much chance of building a better life for themselves and their families as the people living in the high-rise flats. Thank you.
Thanks, Sam. Yeah, 3 really interesting points there. I like this idea of discovering your customers and lowering entry barriers. mobilising private sector actors, and offering expertise with low transactions costs to cities, to utilities, and help development banks rediscover their purpose were your precise words. Now, fantastic. Now we're going to have our three outside experts, in inverted commas, ask a few questions. So very, very briefly, over on the end of the table here, we've got Marta Foresti, who's head of the Politics and Governance Programme at ODI, so Politics and Governance. Debbie Potts from King's College London, working on demographic change and a lot of work on urbanisation or urban growth, particularly in sub-Saharan Africa. And over on my left, Sam Bickersteth, the director or the chief executive officer of CDKN, Climate and Development Knowledge Network, and a visiting, or at least a research associate at Oxford University. So climate impacts, adaptation, climate resilient growth. So these are our broad areas here. So, right, here we go with a few sharp questions and perhaps a couple of comments you might want to add. Why don't we start on the right? Marta.
Okay, I have a questions, a related comment for each of you. First of all, I know you probably won't agree, but I'm going to use WaterAid as an example of an international community that comprises international NGOs, donors, and generally speaking, external actors that seek to support change, often at the national level. So I pose a question to that group of people, which is, are we ready for what it takes? And here it is. I have a worry. I have a worry that we all agree that water is political. We all agree that if you're interested in change, we need to continue the policy engagement and the policy and a political action to make it happen. My worry is, so what? We seem to keep falling back to an expectation that changing policies and changing rules and engaging at sort of the global level on policy change will make a difference. And I have another even deeper seated worry, having worked a lot on in politics and governance issues, that we risk coming to a bit of a dead end where we recognize that there is this, that ultimately, politics is a domestic issue. Who are we to make any difference there? Despite these worries, I'm optimistic because I think there are new ideas circulating, and the evidence, I think, points to very promising directions, the fact that things can be done, but they need to be done differently, and this is my question of what does it take? I think we've heard this morning that there are issues around governance of water that relate to allocations of resources. There are issues to do with regulations and the normative environment. But there are a number of fundamental issues about the governance of relationships between the people and the actors that can make a difference. I think David earlier referred to the practical collaboration agenda and the fact that we're not yet there on understanding how important it is. We made reference to what we call sort of finding ways to resolve collective action problems. We need to recognize that the interests of the different actors may not be along some of the established lines, for example, on demand and supply or private and public, and they need to find ways to collaborate. And we heard about the potential of win-wins and how far they could go. But the language around this was one around alignment of interest, trade-offs, adapting to a rapidly changing environment, making deals, informal politics and informal economics. Does the international community have what it takes to work in that way? Or do we keep falling back in a lot of the traditional programming and policy offers to the demand and the supply, to the fact that there is a private sector that by definition cannot have the same interests aligned with citizens, for example, or using normative frameworks to to put in opposition those who have entitlements and those who are there to serve them. I think in our work we've seen more and more examples, and it was very interesting to hear some of the examples this morning on the partnership and GIZ, WWF and Sat Miller, and things where some of this is being tried out and there are positive results, and somebody's saying rightly it's early days. But I'm still worried that the way we work, the incentives of play, the way we are structured, we as international community, is still quite far removed from the ability of working in this more, what we call politically savvy and locally led manners. Sam, I think what you said goes some way in being, you know, reasonably opportunistic and reactive, adaptive to what exists on the ground. My worry is that your, in a way, market-led solutions, or your emphasis on working with the private sector, will really only work where, in those slums where there is, you know, where the resources and the skills are not too far away. So whether there is a private sector, a vibrant private sector, a decent enough regulatory market that allows that private sector to thrive and not to be captured by political elites, where the level of skills available are such that if only they're untapped, they will deliver results. And I do think in many poor countries, in many fragile states, in many countries with very, you know, particularly failed states and state policies, that ends up being an ideological solution that actually does not have a practical ways of seeing through the level of political capture and the level of, you know, the weakness of some of the local institutions where the local thriving market is just not happening yet or anytime soon.
Good questions.
Thanks.
Right. So, Margaret and Sam, will it make a difference? Or is this same old, same old? And Sam, stiff preconditions, and perhaps some of the specific case studies you talked about are pilots. They're successful pilots. Pilots are always successful, no? Scalability? Margaret.
Tough one. Are we ready for what it takes? I think it's a huge challenge, Marta. And, you know, when we're talking about 16 years, if we were talking about a period of 50, 70 years and, you know, slow societal change, we're not. We're talking about a real shift in gear for transformational change, systemic change. So I would in no way say this is a, you know, it's clearly not an easy process. I think, and there's no blueprint. I think for some time the water sanitation sector has looked around for what's the answer, what's the silver bullet? You know, maybe it's community-led total sanitation, it's behaviour change. Maybe it's a certain type of technology, it's the rope pump. It's not like that. And I think the realisation that we're coming to is that the change happens, fundamentally the change happens at national level where the problem is. So it's not for the international community to set the boundaries and the standards and the guidelines and so on. That framework helps. But I think it's working with, it's working in a different type of partnership, which is quite challenging for NGOs, for the private sector, for government, recipient governments, national governments, and the donor development partner community. It's really trying to figure out that new kind of partnership where the focus is on nationally led, nationally owned government plans that are costed, that are funded, that are reviewed, that really have the resource and the capacity. So I think what I would say is we're looking at three elements really of a rights-based approach, actually, saying let's look at the duty bearer. So let's work with governments who, say in Pakistan, 34% sanitation in rural areas. Well, how are they going to shift that to universal access? Let's try and prove some innovation, prove what can work. Use the examples that Sam's given there about the urban environment. Prove that something can be taken to scale. So work with the duty bearers. Strengthening the system, and I think there's models coming out from the World Bank, from UNICEF, about trying to analyse what are the barriers, what are the blockages, what are the problems. Work with those models together and say, how do we strengthen the system? So what are the blockages? Are they capacity problems? Are they financing always financing problems, very clearly. And then the voice, and I think working with the rights holders, with the community, making sure there is that spotlight, there is the demand. We need to see monitoring of services. We need to see services are sustainable. They're not just election promises. So it's a whole package of activity.
Okay. I'm gonna stop you there because there are
yep,
ideas you can come back with. Sam, very briefly.
Okay, question on public and private. I probably didn't explain very well. 80% of our work is supporting public service providers. So we draw on private sector expertise and know-how, but we make it available to governments and to public utilities, which are 95% of the provision around the world. So the local private sector is about 20% of the needs of the city. And I think the question about the pilot versus the scale, I think, to be honest, we're obsessed with scale. I think if you've got a city with 500,000 low-income consumers, if you've reached 300,000 with water and 500,000 with sanitation, I think you're getting to scale. I think that we're at a point now where we're pulling out and the city and their own resources are carrying on and finishing the job. To my mind, anyway, that's scale. And you've also influenced national policy. So we completely agree. The whole reason we work through governments and service providers is that you have to think about it at scale. And our goal is 100% coverage.
Okay, great. Okay, thanks. I'm going to go over to my left. Sam. Let's have your sharp, nice, short question for our
Okay, well, I'll try and be brief. Normally I'm the optimist, full of examples of things that are working, and I've enjoyed the realistic optimism of Sam and Margaret, but today I want to be a climate skeptic, not a climate change skeptic. So the skepticism is around how development goals associated with water can be achieved in the face of climate change. And we've got through this session over the last 45 minutes talking about sustainability, but we haven't mentioned the words climate change. And essentially I would challenge Margaret and Sam to share with us whether you think we factored in climate change into future plans for universal access. I see these numbers in front of me here, Margaret. We've definitely got to pedal a lot harder to achieve the same goals. We recognise that climate's a multiplier of existing challenges. It's not something that's sort of separate and different. But let's just look at the IPCC's fifth assessment report, which Kevin and others referred to earlier. So it's not that we haven't thought about climate change this morning at all. In the case of Africa, a key risk highlighted with high confidence is compounded stress on water resources facing significant strain from overexploitation and degradation and increased demand in the future. That's an Africa example. In Asia, increased riverine, coastal and urban flooding, including widespread damage to infrastructure, livelihoods and settlements. Increased risk of drought-related water and food security shortage causing malnutrition. Neither climate change nor water separate themselves from human health, food security and livelihoods. These things are thoroughly interwoven. So the challenge is, shouldn't we be assessing climate change scenarios and what they mean for the future of water supply and sanitation goals? What are we doing in the post-2015 targets? The Open Working Group is busily struggling with 19 different themes at the moment, of which one is climate. How should it be mainstreamed? So that's my first sort of challenge. The second one is a different form of sustainability, very different one, but slightly based on a recent visit to a very interesting CDKN project being delivered in Uganda, which tackles the issue of maintenance of water facilities. All of us who've worked in Africa have seen many wells, and we've seen many wells that don't work. Water supply to people is of moderate use, not of no use, if it's not sustained permanently, because the chronic disease burden is not removed, and we see particularly children and elderly people, vulnerability and ability to develop, gain from education, sustain their livelihoods, undermined by the intermittent supply of water. What is the point of achieving these targets if we don't keep the water flowing? This interesting project has piloted at a reasonable scale. It's reaching 30,000 people using a public-private partnership methods and focusing on operations of water supply and developing a water service, local level water supply service system to maintain functionality of wells, using results-based payment to these local agents, and including third-party monitoring of sanitation practices that go with it. So I suppose my challenge here is, are the numbers correct? Have we really got so many drinking sustained supply of clean water, safe and clean water? And have we got the balance between the capital expenditure that NGOs and governments love to spend money on in water, whether it's rural and urban, and the operational investment this is necessary? I'll stop there.
Thanks, Sam. Two good questions. Have we, or are we, factoring in climate change as a multiplier, as a multiplier, and an added, an extra source of risk, given the conclusions of the IPCC fifth assessment? And the second point here about, it's not just about extending services and universal access, it's about sustaining those services as well. That's a kind of long, a well-known problem, I guess, in WASH, but one we're still struggling with. Sam.
Okay, so for the first one, I'm going to be an optimist. We've just looked at all other cities we work, and we specifically try to work out, does the water utility link into the water resource planning for the water catchment in which that city sits? Because we were worried that we were promoting extension of service delivery to the poor areas. What actually has the city got enough water to supply that? And what is the equation? we found out in every single case that the head of the water utility and the water board was very well plugged into whatever water resource groupings there were. The water ministry and the urban planning ministry, they were talking. We were expecting it to be no communication, and there was very strong. So I think that's an optimistic sign. I think it's a good sign. What I think is completely unknown at this point in terms of, I'm talking about the impact of climate change on the availability of water, assuming that's going to go up and down very fast in terms of shortages and floods. What I think is completely unknown is the question that I keep on getting asked by cities when I bang on about the poor neighbourhoods, which is we haven't got enough water to supply the central part of the city. Now you're trying to tell us to take the water to the informal settlements. No one can answer the question as to actually is that positive or negative for the water balance of the city. Our hunch is that actually you save water, you conserve water, and you improve services if you supply the poor neighbourhoods. Because the starting point generally is a lot of illegal connections and a lot of water losses. And 95%, the Cabera picture you saw, 94% non-revenue water. So our thesis is actually you save or you conserve water by supplying people. We're now doing a study on that to prove it. But if you can provide evidence for that, you can imagine what the World Bank's going to think. It's like all of a sudden it's going to become a good thing to invest in the poor district. Quickly onto the thing about maintenance. Again, I'm going to say something slightly contentious, which is I think I'm personally quite tired of the word sustainability. I'm tired of it because I hear it at every conference, and it's almost verging on the patronising, because most governments and water companies and service providers I've met, most NGOs that I've met, including WaterAid, believe in sustainability. They believe in the importance of sustainable services. They believe in the importance of maintenance. There's been appallingly unprofessional work that's gone on in the past in terms of building stuff and walking away. But I think there is a massive understanding at all levels of the importance of operation and maintenance. Us, in terms of our little world, we spend more time looking at institutional arrangements and operation and maintenance arrangements, including capital replacement maintenance, than actually the infrastructure. The infrastructure is secondary, and in some cases are not even needed at all. So it's not an infrastructure job, this is a service delivery job. But I do think the sector's aware of that. And if you talk to some of the big funders, that they say, look, enough already about sustainability. Okay. I think we know what we're doing. The important thing is that wherever we're working, we ensure that the institutional arrangements are in place. By and large, I think they are.
Great. Yeah. Okay. So it's on the agenda.
More about sustainability. I mean, I think you've gone for the jugular there, Sam. I think that is, however we term it, and it is the biggest crisis that we face. And going forward, how do we resolve that? It's not just about wells not working. It's about behaviour change not being sustained. It's about financing not being sustained. It's about technology. At WaterAid, we're tackling this head on. We've got a series of post-implementation surveys when we're trying to look 1, 3, 5 and 10 years down the line and see, are those services still working? And some of the results that are coming in, they're quite scary. They are quite scary, quite worrying. But what we're doing is we're looking at, why are those services not working? Is it as a result of financing? Was the capex there, but the ongoing financing wasn't there? Is it community management? We rely so much on community management. Is that sustainable? Is it about behaviour change? So we're trying to identify where and why services have possibly stopped working. And actually our initial analysis points to what we're now calling sector strengthening, that community management alone is not enough, needs to be backed up with a system of financing, a system of connection to local administration, local authorities and so on. Where are the capacity deficits in the local administrations? That's where we need to work together. So it's a huge problem. And on the optimistic side, we are now looking as a sector, increased quality, increased standards, JMP's raising the bar. So we're not just going for the very basic service standards that we used to. One sentence on the SDGs and is climate change being factored in? I think the rubber will hit the road when the climate change, the financing and the poverty agendas really come together and are costed. And we've yet to see. I have to remain optimistic, but that will be where the fine talk stops and the choices are made. That said, there's a lot of money swilling around in climate change, so if we can use that for broader sustainable development, we're happy days.
Is it additional? Okay, don't answer that one. Great. Okay, we're on to to Debbie Potts. I've introduced you briefly. King's College London. I shall say no more. But let's hear your brief questions.
Okay. I work on African cities, so this comes very much from that sort of angle. Let me just start off with saying 2 years ago I went to the World Urban Forum and I attended a large number of events. One of the things I would say from that is that I agree that the data are very dodgy. Somebody said that, and I really want to press that, because I think, if you know David Satterthwaite, and I'm sure many of you do, there are lots of reasons to think that governments are giving us data about many of these achievements which aren't really good. And I mean, I know that some of the data for some of the African cities that I see frequently published are not right. I mean, I can tell you they're just not right. They make no sense. So let's be a little bit careful about what we've achieved, first of all. That's a bit negative, I know. Another thing I just want to say very, very briefly, because I always want to say this to people, is although people keep going on about, yes, of course, the very poor in places like this are paying more per unit, per litre of water than the rich are, let's bear in mind that they use very, very, very little water, not enough to keep themselves healthy and so on. So people often think, oh, well, that means that we can make money out of them. But in fact, several people have said today, and this is what I'm coming to, is that you can't make money out of them, not unless you're a water vendor who's prepared to sell them 5 litres or something. So this issue of affordability is really what I'm coming to. To me, this is absolutely central to everything I teach about African cities, because it is the key constraint to the policies. You can say we could do this, and we could do this, and we could do this, but ultimately it comes down to what is affordable for the households. I deal at the household level, and so it is about the money, but it's about their money, it's about incomes, and they do matter, incomes do matter. And one of the points I wanted to pick up was that you were talking about very unequal cities, often increasingly so. And inequality is the big thing at the moment, as we all know. Finally, people have figured out that this is really crucial. Of course, decades and decades, people in development studies have been saying this. So at the World Urban Forum, several people were talking about successful housing projects which brought about successful outcomes in terms of water and sanitation as well. And when I listened, I kept asking the question, so how did they afford this? How was it done? And every single time there was massive public subsidy. It came from Venezuela, or it was in South Africa and so on. There was no way that this was a profit-making thing. And there are different ways of doing things in different parts of the world. So let's bear in mind that the fastest urbanising place over the last 20 years or so has been China. They don't do things anything like the way we're talking about here. So there's a big state involvement. So the question I'm coming to is, can you say more about whether the extent to which you find there are, or you think there should be, or there has to be, different models for different types of residential areas with different types of households in the cities of the world. The split between the public and the private. My own feeling, I think you can tell very much, is that very often the public sector really, for the very poorest, is where you've simply got to focus. So I'm really pushing you on answering that question about the role of the public sector and the extent to which big capital can actually successfully deliver. I don't think it can, in my experience.
Margaret, what are your thoughts on that?
I couldn't agree
Briefly.
more on the data deficit. Absolutely critical. We need improved data standards. We need disaggregated data to prove inequalities. So yes, you know, there's a data deficit. On public-private, we strongly believe that the government is the duty bearer for the right to water and sanitation. How that's delivered, what combination of public-private, but the government is responsible for those services. Just very briefly, we did a project with the World Bank about 2 years ago, in fact with ODI as well, with Peter Newborn here, looking at do WASH investments from the World Bank actually impact on the poorest of the poor communities? And it was really interesting. Cut a long story short, that the KPIs that the World Bank had for their WASH investments did not take account of the poorest communities and the social impact of their investments. And as a result of that, they've changed their KPIs. So that's, you know, a big investor into water and sanitation. The other is we're talking about costs, and I would turn it around and say talk about benefits. And the World Bank, again, WSP has done a lot of work on the economic benefits of water and sanitation, the ratio of investment, the feedback, the return, and so on. We're doing a project citywide in 4 cities, saying let's step back from the usual approach where we go in very gently, you know, community by community, peri-urban slum by one settlement to another. Step back, look at a big city, massive urbanisation, Lagos, Maputo, a couple of others, and say, let's look at the whole infrastructure. Let's look at the transport, the energy links. Let's look at WASH. Let's look at health services, and see where we can make some connections and actually really think about this in terms of positive economic development. On the public subsidy, on the public-private, there's usually a mix, isn't there? It's a blend. And for the poorest community, the poor can pay. The poor can be good customers. We have projects, you know, in Zambia, all sorts of countries with the utilities saying the poor will pay. Whether there's cross-subsidisation necessary, that's the other issue. And public funding plays a crucial role in WASH and will do.
And briefly, Sam.
Yeah, I would look at it from the point of view of the consumer. I mean, we are very agnostic whether it's publicly delivered or privately delivered. If I'm living in one of these houses here in the informal settlement in the previous slide, what I'm interested in is quality, price, and availability and affordability. That's what I'm interested in. I'm interested in a good service, the best service I can get. If that comes through an organisation that happens to be a private entity or a public entity, to me that's secondary. What I want is the service.
But you want to be able to afford it.
Is what I said.
Well,
that's what I said. What interests me is price, availability, quality, affordability. That's what I'm interested in. 95% of the suppliers in the world, as I said before, in urban context, are public entities. That will probably continue to be the case. We would advocate what's important is the service for the consumer. In many cases, the entire city is delivered is supplied by a public entity, which is absolutely fantastic, and we will be supporting them to the hilt. In some cases, that public utility will find it more cost-effective for the consumer to use an independent distributor in a particularly remote location which they cannot reach in a cost-effective way, and they will have a contract or an agreement with that utility, with that small independent provider, which could be private, it could be a community-based organisation, it could be a local association, to supply a certain area which is remote and difficult for them to reach. Now, the key criteria is, does that mechanism get the water there at the lowest price possible, the most affordable price possible, in the best quality water available? And in many cases, that's a very common modality. So we would be completely agnostic, and really it's about the consumer. What is best for the consumer?
Okay. Thanks, Sam. I mean, Deborah, that was a really good question on this affordability. It may be, and this sharp distinction, really, between China, where service provision has been achieved through public subsidy. Compare and contrast to India. But anyway, we've got 15 minutes if you're prepared to nibble your lunch break a bit. So let's get some punchy questions from the audience with a little bit of reaction here. So, questions or comments? So we've got one over here from Ian, and looking over there, one on my right from this gentleman. So let's take those two. Any over here on my left? I'm being very democratic. Nope. Okay, so let's run with these two. Keep it short.
Okay, and my name's Ian Ross from Oxford Policy Management. We've been talking a lot about urban, especially urban water. So maybe a question more on rural sanitation and more on the how and why of inequality, because this discussion is on universal access. So Margaret mentioned the JMP data, which shows that inequality and inequity have been increasing. So I'm interested in the views of the panel on why that's taking place. And is it because programming has been going for the low-hanging fruit? If we look at the distinctions between India and Bangladesh, for example, on sanitation, you know, in the lowest quintiles, India has not been doing very well, but Bangladesh has managed to achieve increases in sanitation access across those low quintiles. So what is it that they've been doing differently? So yeah, that's the question. What can we do to actually bring about these changes in inequality?
Thanks. And let's go over there. Yes, you, sir.
Yeah, thanks. My name's Ian Neal from Excellent Development. My question's for Sam Parker. About 10 years ago, I remember listening to a lot of case studies from India on slum-urban networking, whereby basically there was a much more holistic citywide approach of linking storm drainage, sewage, land rights, or formalising land rights, and not just looking at the high-density slum neighbourhoods, but recognising that because they are typically also in the drainage channels in the low-lying areas of cities, that it made sense to link roads, urban drainage, water, sanitation all together in a holistic package. Have you found that to be a more, have you got experience of that as an approach?
Okay, now if there's one more question, I think we should roll it into one. Richard.
Thank you very much, Richard Carter. It's a question for Sam as well, perhaps a little unfair given your present role, Sam, but can the rural poor be a market? They are, after all, the majority of the unserved.
Now, before I get the panel to maybe come back on that, anyone in the audience think they've got answers to any of those? Not at this stage of the proceedings. Okay, I tell you what, I'm going to go to Marta and surprise everybody. I mean, this issue of stubborn inequalities, and their persistence, not just their persistence, but the fact that they may actually be increasing. What lessons can we draw from other sectors? Is this universal?
I mean, it's universal in that the evidence of inequality persisting, for example, in a number of service delivery areas, even in the face of rapid economic growth, is certainly common. It's not universal. We're looking, for example, at the moment at some of the most rapidly growing African countries, and of course you can't in any way compare in any systematic ways, but you find instances of, of discrepancy between the expectations about economic development and growth in relation to, with a number of service delivery remaining abysmal, particularly for the rural poor. So there are certainly some commonalities there about what can be observed. What is perhaps most striking is that there's quite a lot of commonalities about what research shows and what are the blockages, what are the reasons, what are particularly the institutional failures that are drivers and explain those failures. And those we did do some work across education, health, water, and other sectors, and issues around policy incoherence, the level of the type of rent management and rent seeking, the level of capacities. The nature of the political systems behaves similarly in different places and across different sectors. So there's a lot to be learned about the diagnostics. Where I think there is a lot more that can be done is to then move to, is there something that can we learn from doing things differently, and what kind of solutions can be found to some of those problems. And again, that's what I was getting at earlier about the fact that I think it's also fair to say that a lot of the ways and approaches that are traditionally adopted across the sectors in international development to address some of those problems are inadequate in all sectors, and partly because they fail to recognize the realities of the political dynamics and some of the things I referred to earlier around the nature of the relationships, where the power and the interest lies, lots of assumptions about who has power, who has interests, and how that can be addressed.
Okay. Good. Yes. Sam, you had a couple of questions. If you could answer them shortly, that would be good.
Okay, so holistic approaches. I think Philippines, fantastic example. So the Philippine authorities really working very well together. They combined their urban planning process with their drainage process, with their water and sanitation process, and they took the whole thing in one holistic way. Manila Water Company has had a million new customers in the last 10 years. 1 million new customers. And most of them are from the poor districts in the town. But they've worked with urban planning, they've worked with land, they found a way to deal with the land tenure questions. Another city, as a contrast to that, which I won't name, is a place where we were working, and 3 years after our supporting of the government state-owned utility to deal with the low-income area, the whole area was flattened, and the people were moved on, and this became a shopping centre or something. And so what a waste of investment, what a waste of effort. A lot of that was around land tenure, because they actually discovered that the land was owned by somebody else, and the whole thing had to be trashed. So absolutely right. If you can align urban planning, drainage, water and sanitation well, is obviously the best, most sustainable long-term way to develop a city. And very briefly answer to Richard's question, which is very unfair really, because I know nothing about rural, but I would ask the question back to you. Do people in rural villages buy toothpaste? Do they buy materials to build a latrine?
They don't have much ready cash. You know, we readily talk about $1 a day or $1.25 a day, but it's not cash. The amount of cash most rural communities in Africa at least have, or rural households I should say, is pretty small.
In which case I defer. I don't think I'm qualified to answer the question. But I can say people in cities also have very little cash. But they generally have cash every day, a little bit of it. So if you don't take that into account in terms of offering a service, you're never going to serve them.
Okay, good. Audience members, we can squeeze some more in, so come on, wake up. Ah, that's better. 3 instant questions from the middle here. Okay, so let's take these 3. Yeah, keep them short though, and tell us who you are.
Okay, I'm Lekha Hasnan, and my question is that we're expecting more and more people to come into urban areas, and that means that we have to look at this water issue as a dynamic issue and ever-changing one. But I think it's also important to not ignore the rural areas, because that's where they're coming from. And I think the livelihood issue in the rural areas, you know, when we are having all these platforms and we're building more and more, what should I say, we're bringing in transport, bringing in various other issues, we need to also link it to the rural livelihood situation and the facilities available there.
Yeah, good point. Let's take the 2 others, and Debbie, I'm going to get you to come back on that one, okay?
Okay, thanks. Terry Green from the Ideal Group. We talk quite a lot about sort of governance and institutional arrangements. I'd be interested to hear what the panel's experience has been in transparency mechanisms, because we're often working with different sort of municipal or city utilities. And has there been an experience of exposing the different performance levels of different utilities as a means to drive change? So in other words, looking at sort of why some cities or municipalities are doing better, whether it's on price, access, quality of service, etc. I'm interested in an experience in that.
Calow, go ahead. Yeah.
The tiger economies such as South Korea, Singapore, and Taiwan experience phenomenal economic development in a relatively short period of time. Question is, how did they deal with their water management then? Because apparently they dealt with it in advance of the problem.
Okay, well, I'm going to buck the trend a little bit here. I mean, Debbie, if you could get back on the urban. I don't know, Sam, maybe you've got something to say about this sort of issue of sort of transparency initiatives and the way adaptation planning, sector reduction plans, this kind of need to benchmark, to monitor, is happening in the climate change sector. Tony, we've still got Tony Allen over here. Shaking your head. I thought you might want to talk about, how China and Singapore have achieved their phenomenal rates of growth in the tiger economies. How's that happened? So, Debbie.
In answer to that, sorry, yeah, do you want me to take the mic? Yeah, in answer to the thing about the rural areas, on the presumption that the question was not about the normative issue about whether or not you should deal with these issues in rural areas, obviously you should. I mean, that's self-evident to me. But whether, in terms of what I think you meant, is that will therefore affect the rate at which people are going to towns, my answer to that will be twofold. Well, first of all, I don't think that is the role of people who are dealing with water and sanitation, and I actually don't think there's any evidence besides places like apartheid South Africa and China again, and that you can influence in any meaningful way the rate at which people migrate to towns. So don't worry about it. They will go, and then they'll go back. And they go round and round. Oh, they do go back, because I promise you, I could talk to you for hours about it. A lot of them do, particularly in Africa in the 80s and 90s, because they didn't have any livelihoods in towns that would sustain them. Not sustainability, but sustain them. But the point is that if you do nearly all the surveys on why people go to towns, if they're looking at the household head, are always about income. It's about income. It's not about, oh, well, I came here because I thought there might be water or whatever, or that the water was bad where I was. So I don't think it would actually have any effect anyway.
Sam?
Yeah, so obtusely referring to a couple of the questions, thinking about whether our community, essentially the donor community, has in fact been the problem, not the solution here partly, and we haven't really used market-based solutions adequately. We've designed systems where we've provided water supply and sanitation and relied upon community-based responses to maintain them. And in my visit to Uganda a few weeks ago, it was clear that design that we collectively been part of in our organisations has been insufficient and inadequate. The study that we're supporting through this organisation, WAVE, our partner in Uganda, shows that in theory the contribution that the Water Users Association members play to sustain the well is sufficient if it was run as intended to employ local service providers, private sector local service providers, to sustain the maintenance of those wells. But that isn't what happened in practice. So I think it's achievable, but it's how we use the market more effectively. And to get from where we are now, where we rely on donors, do we need more results-based systems? Margaret referred to climate finance. Climate finance was about carbon markets. We've forgotten that. We're now focusing on the Green Climate Fund. The concept of carbon credits, carbon markets, carbon credits can and is being tested in the same project WAVE in terms of development credits and water credits markets. And we're in fact working with one of SAB's competitors, Carlsberg, in the idea of funding a transition for this well maintenance service provider in Uganda to enable the communities to take this on. So there are transitional costs to build these institutions, and at the heart of this it's about institutional arrangements, but I think markets can often play a more substantial role, and we shouldn't think that's just going to work better in cities. It can clearly work in rural areas as well.
Tone, you can very quickly.
Just the question on transparency, monitoring, that one. Incredibly important and powerful. So one of the leading countries in Africa in terms of coverage and performance is Zambia. They have a strong regulator that publishes like a league table on about 12 indicators every year, and boy does that get people moving, because it is really, really powerful, and people don't like to be low down the rankings on any aspect. And as another example of that, the Kenya regulator has, with our help, invented a 10th indicator. It's had 9 in the last 12 years, and they've invented a 10th, which is related to coverage in low-income areas. So all water companies in the country will now have to start reporting on to the extent to which informal settlements are covered with adequate water and sanitation at affordable prices. And they are going to the Africa Water Week next week or the week after to announce it to the world. So we're very excited about that, but very, very powerful.
Tony, can we have a microphone? So we had this question about, rapid...
Yeah. A useful aphorism which I think I coined is that poverty determines water poverty. Water poverty doesn't determine poverty. So we've got to address the poverty side. People are sort of hinting at that, but that's to say, if we think of Singapore, it's only got 5% of the water it needs, and it's not a problem. So clearly you can pile in capital and good governance, then you've got your problem solved. So that's what we're talking about. But poverty got to address poverty as well as water.
Yeah, great. Well, a few final comments from me before perhaps we go to lunch. I'm just abusing my position as chair. Just let me pick up on something Marta said, because she spoke about this sort of rich body of work on politics and governance, political economy analysis, and we had this comment from Kevin actually in the morning saying he could think of no other sector where it should really be possible to abstract politics than water, because water is essentially so political. The passing comment from me is, with all the new stuff I read on water, it's amazing how good water professionals are at abstracting any discussion of real politics from what they're discussing on the Well Nexus or IWRM. Instead, you have three things. We need more political will, more awareness raising, and more capacity building. Those are three markers that tell you the authors don't know what they're talking about and need to understand politics and governance much better than they do. And there we will finish. So join us again. Let's give you 40 minutes. You can scoff a tuna sandwich in 40 minutes. So let's see you at roughly 2:10.